Hey everyone, my name is Dr. Jocelyn Conley, pelvic floor physical therapist, and welcome to today's guided myofascial release treatment with your ball. In today's video, I'm going to guide you through a 6-minute session with the ball placed in your lower abdomen region. If this is where your belly button is, it's going to be over to the side and just below the belly button, but not on that front bone on your pelvis. So not touching any bones, just in the soft tissue to the side of your belly button. If you do have a scar, say a C-section or a hysterectomy scar, you can also place it above, below, or directly on there if you can tolerate that. All you'll need is your ball or a substitute for the ball, something that you can really sink into and relax into, and then maybe a mat or a carpet. And when you place your ball, make sure it's on skin. So I'm going to treat my right side, because I know that side is a little more stiff and restricted than my left side. Just going to set my timer. I don't like to use timers because there's an outcome or an end point that can distract my attention. But for today's purpose, a timer is okay. And just settle in here, melting into the ball, not forcing. If you find that this is uncomfortable, maybe prop your chest up or somewhere else up, maybe underneath your knees, so that you can fully surrender to the ball. And when you're ready, you can come down flat if that is okay for you. Taking notice anywhere that there may be tension in your body. Using your breath to relax even further into this pose. Give your mind a task so that it doesn't wander off anywhere else other than this room, the present, your ball, your body. One thing you can do is just focus on your breathing, intentionally sending air to the area that you're treating, maybe somewhere else that you notice that you're holding tension. I let go. And treating yourself with your ball is different than with a foam roller or any other tool that you would be moving. For this approach, and to really treat the ground substance within our connective tissues, which is the basis of our fluid, must wait at least 5 minutes in a single spot. And as the tissues give, if they give and you notice it, just sinking even further. So we move with the tissues up. We move with the tissues, we don't force. And if anything pops up in your mind eye, a picture, a memory, take note of how that feels within your body. When tissue, restrictive fascia lets go, sometimes the memories that we held within that tissue also, not sometimes, a lot of times, those memories also are free. Try not to figure out why those images popped up. And just acknowledge how they feel within your body and let them go. Come back to breath. Or if that is challenging, repeat a mantra that seems to sit with you. Keeping your mind focused allows you to be more in tune to what is felt within. Feeling is healing. Healing is feeling. And it takes time. We're going to ease our pressure off the ball, slowly lifting up the side that you're treating, and either come back to that same position or come onto your side. I'm going to take 5 deep box breaths where we pause the end of the inhale and the end of the exhale. We're going to take a 4-count inhale. Hold for 4 counts. 4, 3, 2, 1. Exhale for 4 counts. Pause for 4 counts. Second time. Inhale. Pause. Exhale. Pause. Inhale. Pause. Exhale. Pause. 2 more. Inhale. Pause. Audible exhale through your mouth. Pause. And last one. Pause. And exhale. And when you're ready, come into a sitting position. And just take note of how that felt. Maybe you learned something as you did that. And remember that you might not feel anything. because it's not about the big releases within a single session. It's about the very small releases that happen almost very subtly so that you can't even feel it, and that's over and over again, day after day, as you continue to do this work. Thank you for joining me today, and I'll see you next time.